Okay. Well, thank you for that warm welcome. I obviously am speaking English tonight, so if anybody needs a translation of a word or for me to clarify, please just raise your hand and somebody can do that for you. I try to speak as clearly as possible. I don't have anything specifically prepared for this evening because I wanted to have open be able to answer the questions that you came with. And so we can start in a moment with some questions just so I can see who's here and what you were hoping to learn before you left and what kind of things about vaccines you believe and that you don't understand. But I'd first like to tell you how I came to be in the position I am in today and how I started. I have a bachelor's degree in physics, and I worked in a laboratory after my university studies. And I decided that I wanted to work with people, and so I went to medical school and graduated from there and was so happy to be graduating from medical school. And then began my disillusionment during my 3 years of residency, where I started to understand that what I really had become is not a healer, but a highly trained technician for the pharmaceutical industry. And that my skills involved learning how to hunt down disease and how to prescribe medications for it, how to look for disease in healthy people who had no symptoms whatsoever, vaccinating people, and doing tests on them that I really didn't always believe were necessary. So I decided to move into a specialty area where people were much more ill, because I thought, well, maybe those people could benefit from my skills. And so I studied 2 more years to become a kidney specialist. And so I worked with people who had kidney failure or diabetes with, problems from diabetes, high blood pressure. And so those years were a little better because those people do benefit from some of the drugs that have been invented. But what I really learned over those years was that conventional medicine actually created many of those patients that ended up in my office with kidney failure. And that would be one thing if conventional medicine was the only way to approach simple problems. But there are so many ways to approach simple problems, and they're considered quackery and non-evidence-based and unscientific, even though they oftentimes actually cure people and support the natural chemistry of the body, whereas conventional medicine never does that. Conventional medicine those drugs never support the body's functions. They never, almost never, I guess there are always exceptions, but almost never cure diseases. Conventional medicine is wonderful if you're on the door of death, if you have an organ that has failed, or if other things have also failed, or if you have symptoms that need to be dampened down very quickly, because that's what conventional medicine is most good at, is getting rid of symptoms but leaving the disease. So that was unsatisfying to me. And in the midst of, okay, let me back up a little bit. So I continued, and I decided, well, maybe I should teach. So I went to university hospital, and I taught for 2 years. I taught medical students and residents and doctors. And then I went into practice that was part academic and part private practice for 10 years. And it was towards the end of those 10 years that the topic of vaccination arose. Because before that, I was like any other doctor, where I was basically completely uneducated about vaccination, taught nothing about how they are made, what's in them. My education on vaccination included basic things. Number 1, smallpox vaccines eradicated smallpox. Number 2, polio vaccines eradicated polio. And number 3, here is the vaccine schedule, and here's when to give it. They are safe, effective, and necessary. End of story. That was my education on vaccination. So my patients got vaccinated, and I signed orders for them, and I believed that they needed most of them. And I really didn't question things all that much. And then in 2009, we had our own swine flu vaccine, and that was given in addition to the seasonal flu vaccine. And there were several patients that came into my hospital, and they had previously had normal kidney function. And then all of a sudden, they had no kidney function, and they needed to be on dialysis. And they volunteered to me. I was fine until I had that vaccine. And so I thought, well, that's odd. So I decided that my administration might be interested in this, and I was bringing it up to other doctors. And I was really surprised that they were not only not interested, but argued with me and told me that vaccines are safe and effective, and that these people didn't have kidney failure from the vaccine, and that they just got influenza, and the vaccine didn't have time to act. But the problem is that they had no influenza symptoms. So I knew that theory was incorrect, and I couldn't understand why, for the first time in my career, I could make a diagnosis and I could see the potential cause, and I met with resistance. If somebody had had a paracetamol, or if they had had a blood pressure drug or an antibiotic that caused their kidney failure, I would say it. The doctors would say, well, we must stop it because this happens, and that was the end. But with vaccination, it was completely different. And so the irony is that it was the resistance that I met up against in my own colleagues that landed me to do all the research that I've done and eventually leave my job and only do this kind of research and write a book and be here to talk to you. And I really walked away from a gold mine. I was doing quite well in my practice, but there's no amount of money in the world today that could keep me doing that. And so I wrote a book, and thank you. Roman Bystrionic and I wrote a book together. There's about 20 years of research between the two of us in that book. And unfortunately, they all sold out last night in Stockholm. But if you want to take orders in the back tonight, I can ship cases of it here for you if you'd like to. Otherwise, it's available on Amazon. What the book is about is I went and I had to answer my own questions, and I had to answer the excuses that I was given over and over by my colleagues who were programmed to say vaccines are safe and effective, they are safe, give them to everyone. And I will tell you also that in my hospital, there was a policy where if somebody came into the hospital, even if they had terrible infections, heart attacks, cancer on chemotherapy, kidney problems, that the pharmacist would come into the room where they were and offer them 2 vaccines, and if they said okay, they would give them without asking me. These are my own patients, and I was not consulted. Did I want this? And I went into the room one day of one of my patients who had protein-losing kidney disease. It's a very inflammatory disorder. And I saw that there was an order on the chart that said influenza vaccine given, and I thought, well, this has to be wrong. And I looked to make sure it was her chart. It had my name as the ordering doctor. So I had a problem with that, and I addressed that with the administration. And I was basically told that I was confusing the nursing staff by speaking what my views were about this problem, that I should not continue to, that I should stop discontinuing vaccination orders, because that's what I started doing. The other thing, I started looking at all of my patients that I was consulted on. And I started looking to see, there's one question that doctors need to ask when somebody comes to them with a new disease, and that is, when was your last vaccine? Because when they ask that question, they will oftentimes be able to make a connection between a new problem and that vaccine. But they would have to believe that it's possible. So I started doing that, And indeed, I did find that there were some immediate, sometimes within 24 hours, there could be a decline in kidney function. And again, I was met with resistance because nobody could comprehend that these vaccines could actually be causing kidney problems. Even though it's documented in medical literature, even though I found numerous case reports, even though there's a lot of science on the autoimmune stimulation from the components of vaccines, even though none of my particular patients had ever been part of a study looking to see if the vaccines were safe in them. There's no study that tells you if somebody's actively having a heart attack and you give them a flu shot and an pneumonia shot, that they'll be okay. There's no study that showed me that my cancer patient, who had a bag of chemotherapy going in his arm, could take an influenza shot that same day. So I became increasingly uncomfortable with this policy in the hospital and what I was learning on my own. And I started looking into the question of, did smallpox vaccines eradicate smallpox? Because we all grew up believing that that was a good vaccine because we don't have smallpox anymore. And I was shocked and oftentimes horrified by the information that I discovered, that it was completely counter to what I was taught, to what the mainstream tells us, and that I today do not believe that smallpox vaccines eradicated smallpox. I believe that smallpox vaccines were a cause of smallpox. And as the decline in vaccination occurred, there was a decline in smallpox. And that is written about in our book. Those vaccines were made out of pus that came off of a cow's belly that was never sterilized. All kinds of diseases were spread through those vaccines. Then I approached polio because that's more modern. We can all relate to polio. And that's a vaccine where even parents who doubt the safety and the necessity of vaccines often still believe, well, polio, that's one of the good ones. And I believe that too. But again, I did research. I spent time in the library. I had hundreds of articles from history of polio from the 1920s onward. It's actually even earlier than that, 1900 onwards. And I found that not only was there huge amounts of scandal in the history of the creation of the polio vaccine, but that there was actually 1 year where more kids were paralyzed from the vaccine than were paralyzed from the polio disease itself, the virus. And I found out enormous amounts of information on polio. And I won't spend a lot of time right now unless you want me to, because I have a YouTube video that I get into that in great detail. And if you just go onto YouTube and put in Suzanne Humphries polio, you can watch that for free. So that second vaccine I found wasn't what I thought it was, that the minority of these cases that were called polio were actually caused by a virus, that DDT and other chemicals, arsenic in the environment, was largely responsible for the paralysis that we were seeing then, that the actual treatment by the medical doctors was in large part the reason why we saw these children with shriveled limbs. And so again, that really turned my world upside down. Then I went into measles, and I decided, well, we don't see measles anymore. Again, another vaccine I found out that the death rate from measles was down almost to zero before the measles vaccine came in, and that the measles disease is actually beneficial for children, and that when you have the disease, you have 75 years of protection afterwards, whereas when you have the vaccine, you have 10 to 25 years of vaccine protection, which is not always reliable. Then I went into whooping cough, and I looked at that and found, again, all kinds of problems. Today, we see 86% of children who are vaccinated for whooping cough are the ones that are getting it. Okay? 86% of cases of whooping cough today are in vaccinated children. So that's mostly what our book is about, as well as what people were doing 200 years ago, like taking cinnamon and vinegar and onions and all the natural ways that were shown to have a huge impact on the virulence of the disease and the susceptibility of smallpox. So we talk about vitamin C and these other natural remedies. We debunk a lot of the mythology that is propagated throughout the medical system and throughout the mainstream. So since then, I have continued full-time doing research. I study between 6 and 12 hours every day, 7 days per week, and I've done this for approximately 2.5 years with this schedule, because I, at this point, can't stop myself. I just feel so called to do this and to share with you this information that is in our medical journals, to share with you the fact that we have never had any kind of research looking at vaccinated populations versus not vaccinated populations for some of the diseases that are plaguing our world today, like cancer and heart disease and diabetes and autism and attention deficit disorders. All of these things that I personally now believe do have an impact from vaccination. There's never been a study to look adequately at it on a large population level. And there has been active resistance to doing such a study. So I find this to be a major problem. I find it also to be a problem that our mainstream media will not report, will not invite me to talk. Usually they have a pro-vaccine doctor and a mother debate. But the good news is that the mother often wins, because parents today have become so well educated that they actually have graduate level knowledge about these vaccine problems, because they now understand that they are the first line of defense for their children, that they can't trust the government policies, that they can't trust what they hear in the mainstream media, and they've gone and done their own research, and they now understand more than their doctors understand, which offends doctors terribly, as many of you may already know. So that's how I came to be where I am today. And so I'd like to just see if anybody would like to raise their hand and say why they came and what they would hope to learn, and maybe I can meet that question.
I have a question about, are all vaccines shit? Or is there any vaccine that you very shortly can say, this is a pretty good vaccine?
Well, that was, again, a question that I had for myself, because in the beginning I kept, thinking, well, there must still be some good vaccines. But the more I have researched, the more I believe, well, let me just answer your first part of your question, which is actually the first polio vaccine was made from actual shit, okay? So that should give you some kind of an answer. It was made from the stool of 2 children in Minnesota. Okay, so all vaccines. I was introduced into a population of Steiner-educated school children about 7 years ago. And you all know what that is? Well, okay. No? Who said no? Can somebody tell him what Steiner schools are? Yeah, now you know? Okay. So they basically have a philosophy of, biodynamic gardening and farming and recycling and eating healthfully and probiotics and fermenting and non-vaccinating for the most part. Even some Steiner school parents will still vaccinate for tetanus and for polio. But I know many who have learned better since then. So I saw these children, and they looked like space aliens to me, because most of them had never needed antibiotics. They were thriving, they were beautiful and healthy and happy and smart, and I thought, well, wow, that's really different than how I was growing up, and it's really different how my friends were and my family. What's going on here? And so I looked into the whole system. And one of the things was that there was a very low vaccination rate among these children. And so I think that is really important. My opinion today is that no vaccine is safe, that they're not necessary. and that many of them are not effective. And even the ones that are effective, the story is always bigger. For instance, we can say that this pneumococcal vaccine that they're giving children and adults, have you heard of that one? Pneumococcal, PCV. It's to kill a bacteria that can infect the ears and the throat and cause meningitis. And this vaccine is very good at killing these particular bacteria and giving immunity for it. The problem is that nature hates a vacuum. So when you kill those, guess what happens? Other ones take over. So while you can kill the 13 strains of this pneumococcal bacteria, you'll have 10 more come up. It's like weeding, okay? So 10 more will come up in its place, and some of them actually cause worse disease than the ones that you just killed off. So the answer to me is always in working with nature rather than trying to kill and destroy parts of nature. So my opinion today has changed to the point of saying the healthiest children I see are the unvaccinated, that vaccines all are potentially dangerous, that there are reports from all of them of adverse effects, that we don't know long-term what happens with them. So while I can tell you that, most children will be okay after getting the full vaccination program, I can't tell you that many of the diseases that we see every day in our kids, allergies, autoimmune diseases, arthritis, brain tumors, things like that, have no contribution from vaccination because nobody has looked and nobody's going to look. So the other thing is that I looked into how vaccines are made, and that's when I found out that information about the polio vaccine, how that's how that first vaccines were made, and they're still using the same strains of these viruses today. But even if you look at a measles vaccine, well, where did they get you have to always wonder, where do they get the bacteria or the virus or the toxin to make mass amounts of vaccine? Well, in order to make mass amounts of vaccine, you have to have cells to grow them on. So they use all kinds of different cells. Let me just pull up a slide here for you. These are just a few of the examples of the genetic material that can be found in common vaccines. We have now tumorigenic Cocker Spaniel kidney culture called Maiden Derby that is now used to make influenza vaccines. It was initially started in order to make veterinary vaccines, and we're reassured to say that it's only slightly tumorigenic and that you're highly unlikely to develop any cancer from it. But how can they know this? Nobody's looking at vaccinated versus unvaccinated for cancers. We're seeing more and more kidney cancers all the time. During my career, I saw a big rise in kidney cancers. So what we can do is we can get the influenza vaccine from whatever animal in Asia we want to get the first one from, and then we can incubate it on this dog's tumorigenic kidney. And then in order to have these cells live, you can't just give them vegetable juice. You have to put blood on top of the cells. So you have to put a layer of what they call culture medium, which includes animal blood, animal albumin, and often in the past, and still today, can contain animal viruses that they don't know are there, so they don't have a test to look for them. So this is always a potential risk with any vaccine that's made from animals. So by the time this vaccine is completed, what they say in the literature is that we should not have more than 10 nanograms per dose of animal DNA in the vaccine. But what we have found is quite startling, is that there's a Dr. Teresa Deischer who has recently published a paper, maybe last week or the week before, and she's, this is in the manufacturer that when possible, and they always give themselves a little out if they need it, less than 10 nanograms per dose of this animal or human, because some of these cells are human cells. I'll get to that in a minute. And Dr. Deischer's team discovered that the DNA levels ranged from between 142 nanograms to 2,000 nanograms per dose. Okay, so we're vastly exceeding the recommended foreign DNA, animal or human dose. So other things that are used, this is human fetal cells. There were some aborted fetuses in decades past. And they have a lot of stem cells, and some of these cells can rapidly replicate and reproduce themselves, which is what you want if you want to make, say, tetanus or a whooping cough vaccine. You need something to grow it on. So these fetal cells are in there. All of the cultures from human fetal cells also contain human retrovirus. I'll get to that in a minute because that's a problem. When you combine human DNA with human retrovirus, you're basically putting in all of the machinery in order to incorporate this DNA into your DNA or your child's DNA. We have lots of vaccines are made on chick embryo cells. This one here really made me gag because this is the one, I don't know if you're using Cervarix here or Gardasil, but in Finland they're using Cervarix. This Cervarix is made on caterpillar cells, genetically engineered caterpillars. And it's also used, part of the substance to make the inflammatory response involves a salmonella bacteria. So the children that are getting Cervarix vaccines are getting genetically modified caterpillar DNA injections, and we don't know how much. Monkeys. Monkeys were used in the 1950s, and even prior to that, monkey kidney cells. There was a big problem with the polio vaccine because of that. There was one scientist that found that when she would take extracts of these monkey kidney cells and inject them into hamsters, that 100% of the hamsters developed tumors. That's Dr. Bernice Eddy. She was demoted for her findings from the Division of Biologic Sciences in the U.S. government. And she continued to talk about the problems that she was finding, but they continued to use these monkey kidney cells that had a monkey virus in them that didn't cause any problems to the monkeys, but when you inject them into humans can cause, it stimulates two parts of cancer genes and blocks two inhibitors of cancer genes. And one doctor named Dr. Michel Carboni said that this monkey kidney virus was the perfect war machine. Those are his exact words, and he said he couldn't have designed a better cancer virus if he was able to. And so that was in the polio vaccines up through the 1990s because they were not testing for it properly. They weren't finding it. Now it's supposedly gone. Cow blood is used routinely in vaccination production. We have had a problem with pig viruses showing up in one of the vaccines that babies swallow for rotavirus. And we were told that, well, you know, we eat pork and many farmers have this virus, so it's fine to give your baby this virus that comes from pig stomach that is used in the manufacturing process of that vaccine, even though that's a vaccine that's not necessary in the developed world. So that's part of my concern about vaccines, is how they're made and where they come from. So even if they work, I just say, I'd really like to find a better way than that. And there are better ways than that, because none of this is actually good for you. There's no way you can say that there's any nutrient benefit from injecting this material. One of the things we see here is that this human fetal DNA and retrovirus in vaccines coincided with some autism change points. Now, I would just like to say that I don't believe that autism is just from vaccines. I think it's an inflammatory brain disorder and an immune dysfunction disorder that also involves the intestines, but I do believe that vaccines contribute to it, and you can talk to hundreds of thousands of parents who will tell you exactly when their children became autistic and how they saw them decline and how closely related it was to the vaccines. And that the first vaccine, maybe they just kind of walked a little differently or started to twitch, and the second vaccine, it got worse. And the third vaccine, they simply stopped talking. Okay, so we hear this all the time. So measles, mumps, and rubella vaccine used to not have these fetal kidney cells, but then they started using them in the 1980s. And then we started enforcing this campaign. And then we added, in USA, chickenpox vaccine. I don't believe you folks have added that yet. You're still allowed to have chickenpox. But soon they'll be telling you how deadly chickenpox is and that your babies can have secondary infections. And that's what happens, and people will believe it. They'll believe anything they're told enough times. And then we introduced hepatitis A vaccine, which I don't believe you're doing either, but all of our children are vaccinated for hepatitis A and chickenpox and hepatitis B, and every year for influenza, starting at 6 months of age in the United States. And unfortunately, we tend to be trendsetters in the United States when it comes to these things, and other countries are following. Finland has just added, basically vaccinates for the same things we do, except not quite as early. The timing of vaccination, how early they're given, also has a lot to do with the damage, because interfering in the immune system in a very young baby is different than interfering with the immune system at 2 years of age. So you can change the impact on the immune system by waiting, but you can't change the impact on the potential carcinogenic problems and autoimmune problems. So that probably touches a little bit on your question. I tend to be long-winded. I don't do well in interviews. Yeah, but I didn't say that. But see, I have to back everything I say by scientific literature. And so, yeah, like I can think that in my head, but then I have to go prove it. And I believe that I have proven it with what we have available to us. And I think there's much more of a case to say, yeah, these vaccines, they come from places that you wouldn't want even in your trash can, and that there are better ways to deal with diseases than doing this. I also find that the more people educate, the less they tend to vaccinate. Sorry.
So when we go abroad,
yeah,
I do every week kind of, to get vaccination. I can just skip them because they're more damaging than good for me.
Okay, well, that's really up to you. What I tell people to look into before they accept a vaccine is what your risk is of developing the disease that you're being vaccinated for, what behaviors you would have to engage in order to get it, what exposures you would have to have, how effective the vaccine is, what toxicities there are of the vaccine, and what else could possibly be done to protect you besides vaccinating.
But if I don't know anything about this, I mean, on a scientific level, would you recommend me to take the vaccine if I, let's say, for example, go to Bali in the winter or to India? Would you recommend me?
But if you don't know anything about it, you're relying on my opinion.
Yeah, but
and then who's going to be responsible for the outcome, you or me?
Yeah.
So if I tell you not to get hepatitis B vaccine and you go have sex with a prostitute in Bali and you get hepatitis B, you will be mad at me. So I think it's important for you to be able to, it's not rocket science here. You can understand this enough. If someone's telling you need one vaccine to go abroad, you can look into the possible problems. You can also get tested to see that you don't already have it, because you could have had hepatitis B and not even known it and be totally immune to it. So I think it's important that people look into the facts themselves and don't just trust me. See, that's the difference between me and a pro-vaccine doctor. Is I tell you, don't trust me, listen to me, and listen to them, and you're smart enough to make your own choices. I don't take any vaccines, ever. I don't take anti-malarials. I think that for me, I'm willing to accept the consequences of not doing that, because I don't want the consequences of doing it. And everybody I know that has not vaccinated and gone to these countries, I can tell you about a cricket player who's an international cricket player who travels to all of these countries, Sri Lanka and India, and the only time he's ever gotten sick is when he took ciprofloxacin to prevent malaria. He got really sick from the antimicrobial, but he has not had any problems, traveling in these countries. But his mother gives him good advice before he goes there. And that's not an N equals 1 story. There are many people who travel abroad. A lot of people, doctors who are against vaccinations that I know, who travel all over the world and don't take any of them. And I would not go to a country that required me to have a yellow fever vaccine. That's my opinion on it, because I don't want to get it. Yeah.
I realize this could be a really long night. And the story is much bigger than you could ever, you're just going to scratch a little on the surface here.
Yes, that's right.
That's your part, right?
Mm-hmm.
And let's not delve into that now. But I wonder, when I was born in the 1940s, all kids were vaccinated without any question.
Mm-hmm.
No parent could ever question it.
Right.
Myself, my brothers, and everybody. I don't know that we ever got sick from it. I think autism was more or less unknown in those days. But I realize also there has been a change in the immunization vaccine. We have now all these adjuvants. We have aluminum, we have mercury, and all kinds of, apart from all this you're talking about here, which is really scary.
This is new stuff.
Yeah.
But let me tell you about the old stuff.
Was that vaccine in those days less problematic than it is today?
Well, you had aluminum in your vaccines back then because they've been using, do you say aluminum here or aluminium?
Well,
aluminium.
I speak English in America. Whatever. Yeah.
Aluminium has been in the vaccines since the 1930s. And let me just tell you why and how, okay? And then I'll get more into your question. If I was to take a tetanus toxoid or a whooping cough vaccine, bacteria that was killed, or pieces of influenza vaccine virus, or anything that's in these vaccines, if I was just to take a piece of them, like they use in vaccines, and inject it into a baby, nothing would happen. The baby would not develop immunity. And that's because baby's immune system is programmed to be anti-inflammatory. But they discovered in the 1930s that when they were using dirty vials to make the vaccines, that they worked better. And one of the products that was in it was aluminium. And that's when they started saying, well, this is a really helpful thing it's called an adjuvant that stimulates an immune response. And since then, we have considered it generally regarded as safe. There's no top limit of dose that can be given or not given for aluminium. There was 1 year in New Zealand where children were given upwards of 12,000 micrograms of aluminium injections. So you had a little bit of poison back then and you did okay. Were you breastfed?
Yeah.
Yeah. That makes a big difference. In breastfed babies, generally, their immune systems are kept on track. So if you vaccinate a breastfed baby, they can still have trouble. But that inflammatory response is rapidly brought back by the mother's milk, because mother's milk has powers beyond what scientists even understand today, and they admit that. You were born normal vaginal delivery through your mother, probably with no interventions, no injected oxytocin. You weren't given a vitamin K injection either when you were born. So that was all an advantage for your immune system. You got your first dose of probiotics. Your mother wasn't shot up with antibiotics, which killed her probiotics, so she couldn't give them to you, which kept your immune system on track. You were not vaccinated on your first day of life. You were probably vaccinated when you were a couple years old. Today, babies are vaccinated on their first year of life with vaccines that contain aluminium in the United States. Here they don't. Here you just will give a BCG vaccine that doesn't have aluminium. I don't believe it has aluminium. So the vaccines were actually quite dirty back then. The smallpox vaccine was a disaster, but usually wasn't given at very young infants. But as we write about in our book, the boy on the front cover of that book was one of the wounded, that survived the vaccination. But people were leaving the UK and going down to New Zealand to escape having their infants vaccinated with smallpox vaccines because they were watching them become sick and die afterwards. So it's not like things were all enlightened and wonderful back then. Vaccine accidents did happen, adverse reactions did happen, but most people did okay because they were fewer, because more kids were breastfed, because they were born normally, and those things make a big difference. So when I say that I don't believe autism is just one thing, I think there are several things that have to come together, usually, for this horrible dysfunction to occur. So that's the short answer to your question.
Good enough.
Yeah.
For parents that were vaccinated but decide that they don't want to vaccinate their children, essentially breaking the cycle, what would be your advice in terms of the process? What are some things to think about? Nutrition. For example, I had the measles vaccine. I've never had measles. I had mumps, which was great. But if my child got measles, which I'm not worried about, do you think there's a risk then that the parents who are 40, 45, 35, it's obviously going to have more impact on an adult than a child?
Yeah, well, very few adults are becoming revaccinated for measles. And one of the things we're seeing that we wrote about in the book is that we're seeing more epidemics of measles in highly vaccinated populations. And that's because the older population who's truly immune, who had measles, is dying off. And they're being replaced by us, who many of us, if we've not been revaccinated as adults, don't have immunity to measles. So that is a potential problem when measles comes back into the population. However, I have known several adults who have developed measles, and they told me that it was hell and they didn't like it. But I don't really think that they were treated as aggressively and nutritionally as I probably would have recommended, with high doses of vitamin C and vitamin A. But they all say the same thing to me, and it's not a huge group of people, but they all say that even though it was horrible, that when it was over, that they felt younger and better. And so it seems to still do something beneficial to the immune system, even in adults. Now, I don't think it's a good idea to start spreading measles around that way on purpose, and it is a potential problem. However, let me tell you something that this is actually very interesting, and I just made these slides yesterday, so let me just pull them up for a second. We have some interesting literature just coming out. This one was from 2010, and it's not that recent, but I just recently discovered it. And that is that in Croatia, they're using the same strain of measles that we all got growing up. And they found that these vaccinated children were actually shedding live virus and infecting other people. And the vaccine was actually, and I always thought this wasn't possible. Even up until last year, I thought this wasn't possible. And one of the interesting comments in this paper was that if these diseases weren't under enhanced surveillance, that the case would have been misreported or not recognized at all. Or it would have been called wild, in other words, not a vaccine virus. And so we see all the time, not all the time, but I believe it's 5% at least. I wrote the exact numbers in the book, but 5% of all children who get measles vaccines develop measles symptoms. But they tell us that they're not contagious, which really doesn't make a whole lot of sense. And now we can see that, because most of the population is vaccinated with a vaccine that's fairly effective for a vaccine, that probably the vaccination was covering up a lot of this problem. And so now we know that they've shown, because we have more sophisticated techniques today than we did in the 1950s and 1960s and 1970s even, called polymerase chain reaction, where we can actually go in and look at the genetic material of the virus and be able to tell if it's a natural virus or if it's a vaccine virus. The problem is they don't look. Okay, so if your kid develops measles from your neighbor, they're more than likely, you take that child to the doctor, they're going to give the baby antibiotics and say, well, it could have a secondary infection. They rarely will recommend vitamin A, and they won't send it off for a test to see if it's a vaccine virus or a natural virus. Sometimes they will, but the vast majority of the time it won't happen that way. So I mention this because we're being exposed to measles viruses this way, and probably have been for a long time. And that's a double-edged sword, because there's also literature that shows that if those of us who still have some little bit of immunity left in us and we're exposed to the virus, that we will asymptomatically get like a booster. And so we're probably continuing to get boosted by these vaccine shedding and by the cases that are occurring in the population. So if we were to stop vaccinating for measles, we would have to have a plan in place, and it would be one of the, like there are some vaccines I would say cut it right now, but I think measles is one we'd have to think more about because, for instance, because you were vaccinated, were not able to pass on your natural immunity through your milk and your placenta to the degree that you would have been if you were not vaccinated, and that's clear in medical literature. So, we'd have to think about babies in this instance. Okay, there's just let me show you another interesting thing from this paper, because these are just kind of mentioned as an aside, but they also said in this 2008, there were 18 cases of vaccine-associated mumps that resulted from transmission of that viral strain to close contacts who had received their primary vaccination. They're still using this vaccine, but they only use it for the second dose, not for the first dose. So what happens if your first dose doesn't take and you don't become immune? You still can get your mumps vaccine and spread it all around. And this was another interesting comment from that paper. They said about rubella, they said, oh, and by the way, 14 and 32 days after the vaccination, there were no antibodies present in a large majority of these kids. And we can't really figure out why, although it's really not that unusual, they say. And we know that rubella is one of the vaccines that does shed after it's given to babies. So I think that this is a vaccine that really never did what it was supposed to do. And there's a lot of mythology around the risk to a growing fetus of rubella. It's not quite as horrible as we're made to believe. And I could get into that if you want me to, but I don't have to. Okay. It's 7:30. Do we want to keep going with questions, or do we want to have a break? It's up to you. Who wants to keep going with questions?
How long will we keep on?
Who wants to have a break?
One question.
Nobody's answered. Oh, one question more? Okay. Let me get somebody who hasn't asked a question. Go ahead. Oh, I thought someone had their hand up over here. In the back. Yeah.
If you still want to give some vaccines, does it make any difference if you give them the first year of its life, or if you wait?
It does make a difference. And I think maybe, how about when we come back, if I talk a little bit about infant immunity and maybe some of the research that's been done, because that's, I think, an important thing that you might want to walk away knowing more about. The short answer is that from the time we are conceived, the immune system of the mother is programmed to be anti-inflammatory. The placenta is anti-inflammatory. The amniotic fluid is anti-inflammatory. The stem cells are anti-inflammatory. And then when the baby is born, the milk is anti-inflammatory. And so think about it now. If nature has designed us to be anti-inflammatory and our mothers to be holding us in a system that's anti-inflammatory, what do you think about tossing a vaccine into that, which we know, I mean, even if you love vaccines, you have to admit that they're highly inflammatory. So you're interrupting the normal program of the infant immune system. So the earlier you do that, the more problematic it is, because after about 1 year, the anti-inflammatory program is down by about 60%, and after about 2 years, it's down completely. Okay, I'm ready, if you're ready. I would stay here until midnight talking to you, because I like you people. You're very interesting and have good questions. But Krister tells me that they officially are kicking us out at 9, but that we might be able to stay a little longer if you want to. So I'll try to get to as many questions as I can. There was a lady there were 3 people that brought up interesting things that I think everybody would want to know. And there was a lady in the back that brought up an issue about that she didn't vaccinate her children for measles, and if they're exposed, what would happen. One of the things I want to tell you is that before the vaccines came on the scene. People looked at, they went and they talked to parents who thought that their children didn't have measles, and then they tested their blood to see if they had immunity. And they found that 30% of them had had measles and was asymptomatic, or maybe just had a red dot here or a red dot there and a cold. So a very strong, healthy person could potentially not have any symptoms with measles. We find the same thing with chicken pox, is that before the vaccine, they did the same thing, and they talked to parents about parents that thought their children didn't have chicken pox, varicella, and they found that between 50 and 60% of parents who didn't think their children had chicken pox had immunity to it. So it's the same thing, is that some children just don't show the disease the same way. We find also whooping cough can be very subtle, not very, how should I say, strong cough, and a lot of doctors and parents can miss it. There was somebody else, let me see, it was a gentleman that I said, ask that question. Where is he? What was it? I forget.
Yeah, I got a son at home. He's 3 months now, and yesterday was time for his first injection. We decided to wait. But like I said, some of these disorders, you could be quite frightened for them. And especially tetanus.
That's what it was. Tetanus, right. Okay, now you jogged my memory enough that I can talk. A couple of things is that a lot of parents call me just for vaccine consult, and I talk to them on the phone. And I find that most parents have 2 diseases that they worry about, but they're all different. They worry about different 2 diseases, so it's not just 2 diseases. But they usually pick 2 that they want to give their babies, because somehow psychologically it makes them feel better to give what they are worried about. And I find that with information, that their fear level goes down. A couple of things on that is that there have been doctors who have publicly stated that part of the campaign for getting parents to take vaccines involves scaring them. And I don't know if I can pull up this quote that I'm thinking of. Let's see if it comes up here. But the doctors have been quoted in our public newspapers, in the New York Times, about that fear is part of the campaign because it's highly effective in getting parents to vaccinate. So know that you're being manipulated on purpose by the public health authorities using fear. The other thing is that we had a document come through our public health system that was given to all doctors. It was a PowerPoint presentation that was given to doctors. And in that presentation, I'll show you the summary slide, is that they said to these doctors, were advised to persuade parents rather than to inform parents. Why? Because the CDC, Centers for Disease Control, knows now that parents know more about vaccinations than doctors do, that doctors are busy and stressed out, and they're told that they have to see one patient every 10 to 15 minutes. And so to sit there and do everything else they have to do and inform, they'd also have to go learn in order to be able to inform. So they tell them also not to give any printed information to parents. This is I didn't make this slide up. I took this slide off of the presentation. And so they said, don't plan on giving them any information or links. Why? Because they know the doctors will lose a debate with most parents who are asking questions, because they have no clue what's in vaccines. So you have to consider the source of the fear. The plan is to scare you and get you to be compliant with vaccines. Vaccination is a multi-billion-dollar industry that not only are vaccines profitable, but the illnesses that come from the vaccines are also highly profitable and keep a lot of people in their jobs. Now, I don't know if that's the plan, but that's just what I happen to notice. Was that everything? Tetanus. You talked about tetanus. Okay. When I was in Finland last year, many people said that is a disease they're concerned about and they wanted to know more. So I spent most of my summer this year researching tetanus. And I can show you a little bit. I have basically like 100 and some slides on it, but I have a few of them pulled out here that I can show you if you'd like, because that's something that a lot of parents worry about. So let me just show you a few things on that. This is the picture that is used to induce fear in you all. This is untreated tetanus from times past. And tetanus is a terrible disease, and we don't ever want anybody to have it. But the mythology that vaccination is responsible for declining the... Huh? I didn't hear it.
The Swedish name is sorry.
Oh, okay, so you all now know what I'm saying. Okay, thank you. What is the word? See a dump? I can't do it. Okay. It probably has one of those double dot O's in it or something. Okay, so this is the tetanus. I'm told that the public health authorities come around to different places and show this picture to people, because that certainly would, if you didn't know how these vaccines were made and how effective they are not, then you might want to go for this vaccine. It's always important to make your decisions based on fact rather than fear and hype, okay? I also used to believe that tetanus was a horrible disease and that it was one of the good vaccines that we really needed, and that, you know, we should just get the T, just the tetanus, and not the other things. But my mind changed after I actually got educated. So let me just show you a little bit here of incidence. This is 1900, this is 1935, and this is 1970. And these were the death rates per 100,000 for various diseases. Influenza and pneumonia, 202 in 1900, was cut in half by 1935. No vaccine by then, okay? 1970, it's down even further. We had a crap vaccine, to use your terminology, in 1970, which was basically no more effective than water per an official at the National Institute of Health, and it actually was dangerous. So vaccination had nothing to do with the decline of influenza at that point. Tuberculosis, we never had a tuberculosis vaccine campaign in the United States, so our tuberculosis went down with no vaccine. But let's just keep going down here. Look at tetanus. Even before vaccination, tetanus was very, very rare, and death from it was rare compared to these other diseases. But that's not what you would think when you listen to the necessity to get vaccinated. There were 4 deaths per 100,000 in 1900. It was down to 0.95 in 1935. And I asked my co-author, Roman, if he had any data on tetanus, because he did all the graphs in our book. And he said, it says low incidence. It doesn't even really fit on the graphs. So no, there's really no data, because it was really always such a low incidence disease. This is a graph from our book showing you that, okay, measles is the green line. And we're looking at England and Wales death rates. And you can see people were dying of measles back in the time when sanitation was poor, nutrition was horrible. People were living on sausage that was made of rotten meat and sawdust. Child labor laws didn't exist. Mothers were dying during childbirth because doctors refused to wash their hands and were causing puerperal fever. The drinking water was basically the sewer water skimmed off the top. So there were reasons for this back then. Vitamin A was non-existent in people's diets. But look, here's when the measles vaccine came in, okay? And here's where the pertussis vaccine came in. Pertussis is the orange. So I've seen a quote, and I'm going to paraphrase, but the quote says something like, if I were to stand at the edge of the ocean as the tide was receding with a straw in my mouth, I could take credit for the tide receding. And this is pretty much what happened with vaccination here. The death rate had no decline due to that. This is the slide that the authorities will show you about tetanus vaccine. They'll show you that, look, we vaccinated around, here, and we see the incidence and the death rate go down, and yay. But here's what they don't show you. This is what was happening before. This is actually in England and Wales also. We see the incidence and the death rate declining, and then here's where the vaccine came in. So you can see that actually the rate went up a little bit, if anything, but it didn't come down, and eventually it did. And there are lots of authorities that have quoted and saying that the vaccine actually had little to do with the decline in incidence and death. I looked up a little bit about Finland, and since they're your neighbor, I'll just talk a little bit about what I found in Finland is that there's a paper from 1993 that talks about 106 patients that had tetanus between the years of 1969 to 1985, and 5 of them were children, and 4 of them had received all their vaccines against tetanus. The kind of tetanus that kills little babies is called neonatal tetanus. It's rampant in the third world, and often, beware, that third world statistics will be used to frighten you into vaccinating your baby. And we see this happen. There's no reason to give a newborn infant a tetanus vaccine in your country, because your last case of neonatal tetanus was in 1915. Your neighbor's country. And systemic vaccination of babies was not started until 1957. So there's no reason, if you want to do it to yourself because you're a farm worker and you're exposed to the tetanus spores, fine. But I don't think there's any reason to vaccinate a baby and to inject the material that's in there. So that's some of the slides that I have. I have more on tetanus that I could show you. But that's basically just to get you to start thinking that everything you hear about that the disease was rampant before vaccines, that it's untreatable, it's not untreatable. Vitamin C is actually a known treatment for tetanus and preventive. Let's see if I have it. I have it in another slide, so hang on a second. This is from last night. I did a talk in Stockholm on vitamin C. And I did stick a slide in there on tetanus.
But say that you get bitten by a dog in India.
Stop, I'm going to tell you. Okay, so here's from Bangladesh study. Sorry, that was mean. All right, so in Bangladesh, they did a study on people who had been bitten by dogs. And I read your mind. I know what you're thinking now, too. So what they did is they had I don't know how many people. It was like, must have been 50-something people that had the disease. No, it was more than that, actually. I think it was 117 people. Maybe I have it written here. Yeah, 117 humans that developed tetanus between the ages of 1 and 30. And what they did is they gave everybody conventional treatment. Okay, so they put them in the hospital and they gave them fluids and antibiotics and vaccines. Go figure, I can't explain that one. But they also put them on respirators if they needed to, and they got everything that's conventionally required. But half of them received vitamin C and half of them did not receive vitamin C. And they gave 1,000 milligrams intravenously daily, no matter what size you were, okay? So that's important. So whether you were a baby or 30, they gave you 1,000 milligrams. Here's the result. In the vitamin C treated people, aged between 1 and 12 years old, everybody recovered and nobody died in the vitamin C treatment group. In the no vitamin C treatment group, that same group of patients that were not getting vitamin C, 74% of them died. In the adults, or the 13 to 30-year-olds who were larger, so had a relatively lower dose of vitamin C, We have a 37% death rate in the vitamin C treatment group and a 67% death rate in the no vitamin C treated group. If these adults had gotten 100 grams, I believe that we would have had close to 0 death rates, if not 0 death rates in them as well. I have another study that shows that they used rats, and they showed that the rats that were given the toxin all died and got sick. But the rats that were given vitamin C before the toxin or after the toxin all recovered, and many of them didn't develop any symptoms at all. So if you think you have been exposed to tetanus, you should definitely start taking vitamin C and even consider putting it on the wound. And wound management is very important. And let me just show you a little bit about that wound management and what some doctors have said about what really got rid of tetanus. And then I'll let tetanus rest. But this is from a quote. Okay, these numbers that I have on my slides tell you where you can get the actual paper that I'm citing. So if you go to pubmed.com and put these numbers in, you can get either the abstract or the full text paper. But they say that proper wound care alone or with antibiotics can prevent the development of tetanus in the vast majority of tetanus-prone injuries. There's another doctor who looked at all the tetanus between 1900 and 1969, and he said that that the decreased exposure to the spores, because we don't have horses walking in our streets anymore. That's where tetanus came from. We have cars instead, so that's one reason. Improvement in wound care. We learned a lot about how to let wounds heal from the inside out, how to flush them out properly, and give antibiotics when appropriate. Had more effect than immunization, meaning vaccination, in lowering tetanus mortality rates over the last 70 years. And I believe this is from American Journal of Epidemiology, a peer-reviewed journal. So lots of doctors have been saying over the years that it was actually sanitation, nutrition, and wound care and medical care that had more to do with the decline in death and incidence than vaccination. Now we know that the vaccine isn't 100% effective. I can tell you that it's most of the vaccines today and all of them in the past were made on rotten cow hearts. They would call some of the products that came through degradation products. So that's just one example of how the vaccines were made. They would put this cow heart material out and mix it with pancreas from another animal and then put blood on top so that it could grow properly. And we find today that even in 2014 that the vaccines are still impure and they still have some of this product left in it. So just things to think about when you think you're a sure bet of protecting yourself against tetanus with a vaccine, that whether you're vaccinated or not, proper wound care and nutrition and vitamin C should always be part of your treatment. And that babies do not need tetanus vaccines in your country. Okay.
What kind of vitamin C?
Well, the talk was videotaped last night, so I hope that it will eventually be out. But let me just show you the kinds that I recommend. I think it's still here. A couple slides from last night I can show you. And I believe everybody should have this in their house at all times. These two types of vitamin C. You can get them through iherb.com in your country. This one here is Nutribiotic Sodium Ascorbate. It's inexpensive, $14. Let's see, euro is 11.43. So you're talking like, what, 100 kroner or something like that here. Sodium ascorbate? Because that's unusual to get powder form. You can probably buy capsules at the supermarket. Okay, good. Well, if you can get sodium, that's not sodium ascorbate, though. that's acidic, and your kids are not going to like you if you mix that into a drink and give it to them. And also, the body is designed, the transporters, to take sodium with the ascorbate. So it works with your body. So everyone should have this in their house. Because whether you have any illness at all illnesses consume vitamin C. So whether you have low vitamin C when you start being sick, you will have low vitamin C when you're done being sick. And drinking orange juice is not enough to treat most diseases that need to be treated with high dose. This is the other form. This is kind of a gel form, and it gives you higher levels in the body. And babies, you can just swab it into their mouth, and it's a very effective whooping cough. I combine these two when I treat babies and children with whooping cough. This is another kind. This goes into fat, but I'm not as enthusiastic because it's expensive and it's a low dose. And then there's intravenous, which if you're really seriously ill, you can take intravenous, but it's all out of your system by 6 hours, whereas these kind, you can keep redosing every 2 to 4 hours and keep your levels up when you have a flu or some other kind of problem. I actually put this right on wounds. I treat pets with it and find that it's useful for everything because whether you have a wound that needs to heal or a virus or a bacteria or a snake bite or a spider bite, these are all antioxidants. They donate electrons, and electron donation is the key for all of this kind of disease reduction and antitoxin. That's what an antioxidant is. It donates electrons. And vitamin C is the most powerful antioxidant. It's more powerful than any of the ones your body makes as well. It's more powerful than glutathione. So it's vital to have in your house.
How much would pregnant women?
Let me get you my pregnant woman slide. It's very interesting in pregnant women, actually, because we hear over and over that it can cause abortions and miscarriages. I've never seen that happen. I know pregnant women that take 5 to 6 grams per day and have beautiful outcomes. Your cells cannot divide without vitamin C. The baby can't make bones or skin or organs. The adrenal glands require lots of it. The eyeballs require it. So I went around to see who's been using vitamin C and how much, and I found not this slide, but there's a doctor named Dr. Klenner who used to give 5,000 to 6,000 up to 15,000 milligrams to pregnant women every day. But one interesting thing is this jaundice that happens. But first let me go here, because whether you have high enough vitamin C levels in your body or not, your baby is going to drain your vitamin C. The priority of nature is to get that vitamin C into the baby because it can't grow without it. Neither can an egg grow into a chicken without vitamin C inside of it. So the baby's placenta, the cord and the baby will be twice the level of the mother's blood, and the amniotic fluid will be 3 times the amount. So what the baby is swallowing and being bathed in has lots and lots of vitamin C. And labor and delivery is a very stressful event that has extremely high levels of catecholamines that are almost off the chart, even compared to a tumor that is deadly that can secrete catecholamines. The baby has a huge amount. It's necessary. This is necessary at birth, and there are mechanisms to keep it down, which involve the mother, her milk, the vitamin C level of the mother. If the mother doesn't have enough vitamin C in her system, this is what can happen to the baby, is jaundice. And they find that high bilirubin correlates to lower vitamin C, and lower bilirubin in the babies, they usually have higher vitamin C levels. So they just checked a bunch of babies to see if there was any relationship. And they find that higher vitamin C levels in babies means lower bilirubin. And I found this Italian article, and I had somebody translate it for me, because we're told that 60 to 70% of babies have jaundice. And that we need to give them blue light to treat it. And they say it's just how it happens. Well, it's not just how it happens. This Italian doctor gave 89 of his women 1,000 milligrams every other day. It's a pretty low dose, actually. And what he found is that 61% had no jaundice in the baby when the baby was born, and that 24% had mild and only 3% had moderate. So he found almost the exact opposite of what we expect. So it's very important that pregnant mothers eat well, have lots of greens because they need the folic acid and the magnesium and the vitamin K, and that they have lots of fruits and vegetables and food that is high in vitamin C. And we find that the blue light that they put these babies under actually lowers the vitamin C levels, it lowers the glutathione levels, even though it does lower the bilirubin levels. It's another thing in medicine that's all backwards, and they're going about it completely wrong, treating these babies, as far as I'm concerned. Yeah.
So if an adult gets yellow skin without any disease, it could be because of low vitamin C.
Okay, bilirubin is a powerful antioxidant. Okay, so nature always has plan B. Plan A is for the mother to have lots of antioxidants in her system to be able to deal with the stress that happens at birth. But if she doesn't, plan B is for blood cells to break open and make this bilirubin come out. So it's preventable, according to this Italian study, and the levels in the babies are lower when they have higher vitamin C levels. So the treatment, mothers should take vitamin C while they're breastfeeding. It can increase in the milk. And to just keep feeding with breast milk and make sure the urine flow is high, because eventually it will just come out of the baby. But the reason I say it's all backwards is because we know that, that high bilirubin levels often, most of the time, don't cause any problem to the baby's brain. And we know that baby brains can have encephalitis even with low bilirubin levels, because it's not just the bilirubin. It has there are a lot of other factors that go into the baby's brain becoming diseased, like whether the blood-brain barrier is still open, whether they have enough albumin. Look what the blue light does to albumin. So there are more factors than just bilirubin and jaundice. See, conventional medicine likes to simplify everything in order to give a treatment, but it's not only is it damaging, but it's missing out on the bigger picture.